My name is Dr. Alejandro Chavez-Badiola. I am Medical Director at New Hope Fertility Center in Mexico, and we're based in Mexico City and Guadalajara, two beautiful cities in Mexico. We are actually the largest IVF clinic in New York. John Sang, who is the founder of New Hope, he got his PhD in Cambridge in reproductive genetics. Then he went to New York, where he got his training. During one meeting, he met a group of Japanese guys who actually were the founders of the largest clinic in Japan, in Tokyo. Our logo, the stork, is a gift from this clinic, the Cattle Ladies Clinic. And that's how the New Hope project began, with minimal stimulation, a very similar approach to the Japanese stimulation and the way in philosophy to do IVF. I came back from the UK to Mexico with the intention to open an IVF clinic. I really liked the way that they were doing IVF, the sophisticated lab, the results that they had, and I asked him to train me in the way that they were doing IVF. And at the time he was very interested about opening in London. So I had a license to practice in the UK, and that's how I got involved. But at the end, I always wanted to come back to Mexico, and we come with the idea to open the first New Hope outside of the States, and we opened in Guadalajara. After 5 years, I came here to Mexico City, and that's how we're here now. And with technology to overcome some of the bottlenecks in IVF, like the number of eggs. So we decided to follow the Japanese approach, which tends to be minimal stimulation, but in practice it's not about the amount of medication that we give you, but instead to focus on getting the most of the viral reserve, getting the most from one cycle. And we aim to get top quality eggs. Of course, this is IVF, numbers is always good to have them on our side, but top priority is top quality eggs. So we focus on that, and then on average we tend to have fewer eggs than when you undergo conventional stimulation. But the second part is the lab, and we need to make sure that our lab has top technology to compensate and even successfully overcome a lesser number of eggs. So we work a lot on that, standardizing our procedures, the processes, and introducing relevant technology. One example is spindle identification. So before we freeze an egg, before we inject an egg, we make sure that the spindle, which is the nucleus of the egg, is mature. And this is not something that you can see with the naked eye on the microscope. You need a filter, and then you make decisions. We are pioneers in developing artificial intelligence as well, and we use artificial intelligence to help us assess an egg. So when you're freezing eggs, the question is, how many eggs do I freeze? 5, 10, 15, 20. Most doctors may tell you the more the better, but the question is, how many children are you planning to have with these frozen eggs? So we can make a plan. And then if we have 20 eggs from one stimulation, there is a good chance, even if you're young enough, that not all will have top quality. So, of course, we don't want surprises in 10 years from now when you want to thaw and fertilize your eggs. We want to understand how these eggs will potentially behave, and we are applying artificial intelligence to help us assess the prognosis that each egg has in terms of fertilization and the chances to develop and become a good-looking embryo. This is a top technology with very experienced embryologists, but this is not more expensive. The spindle identification is part of our protocol and is not an extra cost. The use of artificial intelligence for eggs in particular doesn't have an extra cost either. When it comes to other forms of AI, like AI for sperm selection for injection, or AI to help embryologists to prioritize the order in which they should be transferring embryos, that has an extra cost, but it's not massive. If you compare it against the overall cost of an IVF treatment. And what we aim is at the end to give each patient the best chance to achieve a pregnancy, a healthy pregnancy, in the shortest time as possible. So AI is aimed to assist embryologists to achieve this goal. So the cost is practically irrelevant when compared with the overall cost of an IVF treatment. At this point, I think that the genetic technology, the genetic tests that we have available have one main purpose, and this is to help our patients reduce time to pregnancy and give them the best chance to have a healthy baby. As everything in medicine, the current genetic tests have margin for error, and it's important to understand the limits and what it can be achieved with these tests. Otherwise, it would be difficult to understand what we're doing. What kind of genetic tests do we have access to? The very basic is counting the number of genetic packages, which are called chromosomes. And with this approach, we are reducing the risk of miscarriage and other genetic problems such as Down syndrome, Edwards syndrome, which are higher as you grow older. There are other more complex genetic tests when we have a couple that have a family history of a genetic problem, let's say Huntington, cystic fibrosis. Then we can open genetic packages, so we can look for specific genetic anomalies, and we can learn whether the embryo is healthy, is a carrier, or has a problem. And then we can avoid genetic problems in this way. There are other forms of genetic tests which are called polygenic diseases or conditions, which depend on correlations of several genes. We can also use this technology in order to reduce potential risks of diseases such as diabetes, some forms of cancer, and metabolic problems. There are other even more complex genetic issues like mitochondrial diseases, for which we can reconstitute cells. We can reconstitute an egg and then have healthy babies. And actually, at New Hope, we had the first library following this technology back in 2016. And it was a collaboration between New Hope and New York and Mexico.